Chikungunya is a viral infection caused by the chikungunya virus. This arbovirus belongs to the alpha virus genus, part of the Togaviridae family. Chikungunya is primarily transmitted through the bites of infected Aedes mosquitoes. These mosquitoes love tropical and subtropical regions. Other modes of transmission include mother to child during childbirth, blood transfusions, and organ transplants, though these are rare. So, how does it work? Once an infected mosquito bites you, the virus enters your bloodstream and starts infecting various cells, particularly fibroblasts and muscle cells. Your body's immune response to the virus causes the classic symptoms of chikungunya. The virus can persist in some tissues, especially joint tissues, leading to long-term complications. The severity of chikungunya is driven by the virus's rapid replication in immune cells, leading to an excessive release of pro-inflammatory cytokines, which causes widespread inflammation, particularly in the joints and muscles. In some individuals, this immune response persists, resulting in chronic joint pain and arthritis-like symptoms. Inflammation can also affect blood vessels, leading to vascular dysfunction and increased permeability, causing swelling and pain. Host factors such as age, pre-existing conditions, and genetic predisposition can exacerbate symptoms, making recovery slower and more severe. This combination of immune dysregulation and viral damage underlies the severity of chikungunya. Now let's talk symptoms. Symptoms usually start 3 to 7 days after the mosquito bite and can last from a few days to several weeks. Common symptoms include high fever, severe joint pain, muscle pain, headache, fatigue, nausea, and a rash. The joint pain can be debilitating and may even last for months or years, resembling conditions like rheumatoid arthritis. Diagnosis is mainly clinical, but can be confirmed through lab tests. Serological tests detect antibodies, IgM and IgG, in your blood. RT-PCR detects viral RNA during the acute phase, and virus isolation involves growing the virus from your blood, though it's less common. The blood profile typically shows leukopenia, low white blood cell count, thrombocytopenia, mild to moderate drop in platelets, and lymphopenia, reduced lymphocytes, during the acute phase. Inflammatory markers like C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, are elevated, indicating ongoing inflammation. There may also be a mild increase in liver enzymes, such as AST, ALT, reflecting liver involvement. Unfortunately, there's no specific antiviral treatment for chikungunya. Management focuses on relieving symptoms. This includes rest, staying hydrated, and using pain relievers like acetaminophen for fever and pain. NSAIDs like ibuprofen are also used, but should be avoided if there's a risk of dengue fever. During the treatment of chikungunya, adequate hydration and rest are crucial to support recovery and reduce the risk of complications. Acetaminophen, also known as paracetamol, is recommended for managing fever and joint pain, as it is safe and does not increase bleeding risk. Nutritional support with a balanced diet helps in maintaining energy and strengthening the immune system. Patients should also be monitored for any worsening symptoms, especially joint inflammation, and may require physical therapy for long-term joint pain relief. On the other hand, NSAIDs like ibuprofen and aspirin should be avoided unless dengue is lab excluded, as they can increase the risk of bleeding. Self-medication without medical advice is discouraged, and corticosteroids are generally not recommended unless advised by a healthcare provider. Finally, strenuous physical activity should be avoided during the acute phase to prevent aggravating joint and muscle pain. Prevention is key. Reduce mosquito exposure by using insect repellents containing DEET, wearing long-sleeved clothing, and using mosquito nets. Control mosquito populations by eliminating standing water and using insecticides. While chikungunya is rarely fatal, it can lead to significant morbidity due to prolonged joint pain and inflammation. Potential complications include chronic arthritis, neurological conditions like encephalitis, and even heart and liver issues. Risk factors for severe chikungunya include older age, as elderly individuals are more likely to experience prolonged symptoms and complications. Pre-existing conditions like diabetes, hypertension, or rheumatoid arthritis can worsen the severity of the disease. Weakened immune systems due to chronic illnesses or immunosuppressive therapies also increase vulnerability. Additionally, pregnancy is a risk factor, with pregnant women at greater risk of severe outcomes. Genetic predisposition and co-infection with other viruses, such as dengue, can further elevate the risk of severe symptoms and delayed recovery. So, stay informed and stay safe. Catch you next time.